Yesterday, services at the Uganda Cancer Institute almost ground to a halt following a sit-down strike by a section of health workers who protested the delayed payment of their December salaries. Over 200 healthcare workers who are on the government payroll did not receive their salaries, leaving them unable to report to their duty stations.
They're telling me that they're unable to come because they have no transport. That's the reason they are giving me.
I don't want to say it is a strike because some of us don't know that there is a strike. There is, although we are hearing rumors.
Today, the institute authorities have indeed admitted that some of their members of staff did go through the festive season without their pay.
For the contract staff, the salaries and the wage bill came in time because it's two different pots of money, and we're able to pay them in a timely fashion. For the established staff, we had delays.
But Dr. Niyonzima has explained that the delayed salaries follows a shortfall in the institute's funds to cater for its wage bill.
If you remember, in June, July, we had salary enhancements for all medical workers, and what that meant is that the wage bill expanded. And when the wage bill expanded, we had delays in receiving all the money that was required to meet the new wage bill.
However, the institute has now received additional funding from the finance ministry to pay the health workers' salaries.
And like I've mentioned, the salaries have been processed, and we expect to have everybody have their salaries by the end of this week. Like the quarterly allowances which were due have also come, and we're also paying out those.
About 30 patients seek treatment and other cancer-related services at the Cancer Institute every day. We sought to find out if any of these services were affected by the shortfall in funds apart from the staff's salaries.
Many institutions suffered budget cuts. The institute did not suffer those budget cuts, so the funding to the institute was retained as it was for the previous years.
But going forward, Dr. Niyonzima says that they are working with concerned government agencies to ensure that this scenario does not occur again.
And it requires us to work together closely with the Ministry of Public Service and Ministry of Finance to ensure that our wage bill is adequate, but also comes in a timely fashion.
This is not the first time that healthcare workers are expressing dissatisfaction over the delayed payment of salaries. Others include healthcare workers who provided services in the COVID-19 pandemic and the Ebola outbreak, who have been speaking out on the matter since last year. Joyce Nakato, NTV Tonight.